All right, guys, so we left off yesterday talking about our fracture types. So we're going to kind of review these real fast. I know you have them in front of you, but try not to stare at them. So remember, we talked about our first two types, which were our closed and open. So that's the two categories of fractures that you can have. So again, closed means that whatever happened to the bone, everything is still in the skin, whereas open means that it has come out of the skin. Okay. Then you can describe the various fractures based on what the actual break looks like. So we said that this was transverse because it's straight across, like our transverse plane that we talked about. Okay. This one with the spinning motion, this lets us know that it's a spiral fracture. One that is shattered, like this one, is a comminuted fracture. This one with the pressures going in opposite directions, that means that we have applied too much pressure. So this is an impact fracture. One that does not go all the way through is a green stick fracture. And one that is angled is going to be an oblique fracture. Okay. So in our, let me see if I can go back real fast. When we were first talking about fractures, we talked about how you repair them. So we talked about a reduction, either being open or closed, and a fixation, either being internal or external. So reduction was talking about the incision that you have to make in order to align those bones. And open means that you have to have an incision. Closed means that you do not. Okay. And our fixation, being internal, means that you had to have screws and pins placed on the bone itself, or external would be outside of the body. So that either means screws and rods going into the bone from the outside of the leg or the arm or wherever it's at. Or you could talk about simply enough like a cast. So let's look at these real fast. Okay. So you already have the picture on your screen of the external fixation. That's about as graphic as this gets. So here's a picture of an x-ray. This is somebody's ankle. So this is the tibia here, and this is the fibula over here. And then this is the bones and stuff that are comprising the ankle. Okay, so they broke probably somewhere right in here, and then they probably broke this little piece off over here as well. It's a typical fracture when you have an ankle that twists and you have a break here. So notice that we've got a plate here, and then we've got a series of screws. This screw looks like it's going down into the ankle bone, and then you've got another couple coming up that's going to seal off and connect this piece back together. So that would be an internal fixation. And you probably had to make an incision in order to get that in there. So this would be called an open reduction internal fixation, or they usually call it an ORIF. Okay. This one is an elbow. So this is hang on, I was looking at it again. Actually, I think I lied before. I don't think this is an elbow. I think this is a leg. I think this is a femur, and this is your tibia fibia, because I think that is a kneecap right there. But I'm trying to see. It doesn't make sense that you would drill through a kneecap into the femur like that. But maybe it's because the other bone over here for the arm is so shadowed. Maybe that's what that is. Okay. Never mind. I lied. I'm going back to the arm. So this would be the humerus here, and then radius and ulna down here. I think it's just so far on the other side. It's hard to see it. But I think that is all one bone right there. So anyways, so I fractured my humerus when I was in the first grade, and I had pins that were placed approximately just like this in my arm. The pins looked exactly like this, and they were placed in kind of going up into my arm like that. And they classified mine as also as a open reduction internal fixation as well. Now with the plates and the screws, that's probably going to stay there. With these pins, they're going to take them out after the bone has healed. So I was awake when they removed these pins out of my arm back when I was, well, that made me like 6 or 7. I laughed because I thought it was funny. It tickled. Not everybody's going to feel that way, but I thought it tickled. So, whatever. All right. So this is a very gnarly foot. This is an external fixation device. Okay. So we got some gnarly toes going on here, but their foot is swollen because they seriously jacked up their leg here and their foot. So I'm sure their foot does not normally look like that. And their toenails are also not going to be orange either because that is like the betadine stuff that they use for the surgery. So a couple of different reasons of why their foot probably does not normally look like this. Okay, but notice all of these pins here. Okay, so this pin right here goes into their foot and it is going to go through a bone to hold everything in place. So we've got pins here, 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 and here. We've got another here. You've got all of these going through their legs back here as well and through the ankle here. I mean, they've got a series of rods and pins going in to reconstruct this. Usually you see these external devices with really bad breaks and things like that. You don't see this for like a typical, like I fell off the monkey bars type thing. So, but these are kind of grody looking, if you ask me. All right, so we're going to watch this video real fast. The link that you have, I don't know why I put that link on there for you. It's for a hip replacement, for like a joint replacement, which you can watch it. It's cool. It still has to do with the same thing, but that's not necessarily what I was going for. So we're going to watch this video real fast.
Grammarly helps make your writing clear and concise, no matter where you are. With Grammarly on your...
If a person breaks their ankle and the bones no longer line up with each other, a doctor may need to perform a surgical procedure to reposition and secure the bones. The ankle is the joint that connects the leg and the foot. The ankle joint includes the 2 lower leg bones, called the tibia and the fibula, and the ankle bone, called the talus. Together, the ends of the tibia and fibula create a mortise or slot for the talus, which forms the bottom of the ankle joint. Tissues, called ligaments and tendons, support the ankle bones. Ligaments attach bones to bones, and tendons attach muscles to bones. The ankle joint allows the foot to move up and down. Ankle injuries usually happen during athletic activities, falls, or car accidents. The most common type of ankle fracture occurs when the foot turns inward and the ankle rotates outward. If the fracture is stable, the pieces of bone still line up in their normal position. In any type of fracture, more than one bone may break. In a displaced fracture, the pieces of bone no longer line up. If bone breaks through the skin, it's known as a compound or open fracture. In addition to broken bones, the ankle may be sprained. This means the ligaments have been stretched or torn. If the ankle is very swollen, the surgeon may delay a surgical procedure to allow the swelling to go down. During this time, the surgeon may put the ankle in a splint to provide support. In addition, the surgeon may recommend elevating the ankle above the level of the heart and applying ice to it. To treat a stable ankle fracture, the healthcare provider may put the leg in a cast or boot to keep the ankle from moving so that the bones can heal together. Displaced and compound fractures with multiple broken bones and torn ligaments may require a surgical procedure. The most common surgical procedure to repair a displaced ankle fracture is called an open reduction with internal fixation. To begin, the surgeon will make an incision over the area of the fracture. The surgeon will open up the ankle to view the pieces of bone and line them back up with each other. A plate and screws will be used to keep them aligned. Additional screws may be inserted through another incision to hold other fracture fragments in place. If the ligaments holding the tibia and fibula together are severely damaged, the surgeon will place a screw through both bones. Or a suture device may be placed through both bones. Either of these devices will help hold the bones together while the ligaments heal. At the end of the procedure, the surgeon will close any skin incisions with stitches.
I think it's the best kept beauty secret. And
All right, we don't care about that. Okay, so you're beautiful the way you are. All right, so that was a video kind of showing basically this procedure right here. So notice how this is why I thought that this bone over here was probably broken, because they were screwing that back into place, but it had that same plate and screws kind of put in as well. Okay. They would have to do like an MRI scan in order to see ligaments and stuff that are torn, because x-rays are only going to basically show you bone that's broken. So fun fast fact. All right. Okay, so dislocations, these can be gnarly too. But again, the pictures that you're going to see, you already have them on your slideshow, so you can already look at those. Okay, so dislocation is an abnormal position of the bone out of its normal joint. So wherever it's normally supposed to be, if it's moved, obviously that's a dislocation. Okay, so first aid for dislocations, do not fix them. I cannot stress that enough. Okay. If you dislocate, just like the video was talking about, that you have ligaments and tendons that are trying to hold the bones in place. If you dislocate something, you are going to stretch those ligaments. You also have nerves and blood vessels. So if you try to pop something back into place, you might pinch something, you may tear something, you may cause more damage. So never attempt to fix it unless somebody is a medical provider that's trying to fix it. Okay, so here's some x-rays. So this is definitely an arm. Okay, so this is the humerus again. This is going to be your ulna and then your radius over here. Okay, so we have a dislocated elbow. Probably, I would say, force of the hand, and that force coming up in this direction, and it just sort of knocked those bones out of the joint there. Here's a finger. This one's fun. I don't want to necessarily see this one in person, but the x-rays are always fun. So we have dislocated between our proximal and medial phalange parts here. Okay, so dislocated there. So again, pictures next, but you already have them on your screen there. Okay, so here's a dislocated shoulder. So in case you can't tell, there's a cute little arrow there. Okay, so the humerus is out of the socket where it comes together with the scapula back here. Just looks disgusting. Here's an elbow. So the same kind of dislocation that we just saw with the x-ray, this is pretty much the same thing. So we probably that force coming back this direction just kind of pushed that bone out of the joint. Here's a foot. This one's kind of I don't know. They're kind of cool looking, but they're kind of like, I don't actually want to see it in real life because it would probably gross me out. Anyways, so we have this foot that's turned. So we dislocated the foot from the end of our tibia and fibula over here. So again, you're really stretching. Notice that the skin is like very stretched over that area. Again, ligaments, tendons, and stuff are also stretched. So you want to replace it, put it back in the normal joint as quickly as possible. But like I said, do not do it without medical help, okay? Because you don't want to cause more damage. Oh, sorry. So we're gonna watch this short video here. This does show a doctor taking a dislocation and putting it back into place, but I promise you it's not disgusting. There's no popping. It is a little girl, but it's gonna be okay. It's gonna be all right. So we'll watch this video real fast. And another advertisement. Oh my goodness. Oh, yes.
Dr. Paul here. We've got a young lady who I think has a dislocated elbow. Let's go take a look. Okay, knock on the lock. So, who's this? Is that your unicorn? I heard you were at school when you got your owie. Yeah? Mommy's gonna hold your cup? I'll hold your cup. Okay. You wanna hold this unicorn with your other hand? This hand. Can you hold it with that hand? Can you lift that hand up? Say tickle, 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 tickle. Here's the hand. Hold this hand. Can you pick it up with this one? That one there? No, it's hard. You want to pick it up with that one. Okay, I'm gonna sit right there. So I have a tongue blade for this hand and a tongue blade for that hand. You grab it? Go ahead, it's yours. Does it hurt to move your hand? Okay, don't worry. So we're gonna fix your elbow, okay? Okay. So when we fix the elbow, it's like, I'll show you with this hand. We would pretend like we're shaking hands. Like, hi, how do you do? And then we would turn your hand up like that. And then we would straighten it like that. Sometimes just doing that will pop it. If that doesn't work, I pull a little bit on your hand, and while I'm pulling, I put your palm up to your shoulder and poop, and it's fixed. Okay? Now when we fix these, there'll be a momentary yelp. Alright, so we're gonna be very careful with your hurt arm. Now the first thing to do is to just feel your arm, make sure it doesn't hurt. So folks, this is something you would be very careful at home. You wouldn't do this maneuver if somebody might have broken their arm. It's very important that they have the actual pull injury that dislocates the elbow. And so to make sure there's not a broken bone, we're gonna push on all the fingers, push on the hand, and you're watching facial expression while you do this. This is a common place for a fracture for a child. They fall on an outstretched hand and they break their bone right there. So you squeeze pretty hard and see, it doesn't bother her a bit. So we're squeezing all up and down, not a problem. We can wiggle the wrist, no problem. Move the arm like that, no problem. So remember, we're gonna shake hands. You support the elbow so you can feel it pop back into place. Then you turn it and it just popped. I just felt it when I turned it. It's all fixed. It's all fixed. You did it. Look, you won't be able to believe it, but you can hold this now. It works. Try it. Try it. Look, it works. Look, 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 look. It works. You can use your hand now. See? Here. You don't believe me? Look. Try it. Here. See? There. You can move it now. Now she's moving it. So I actually felt it with my left hand when I did the twist. I felt a little pop. It's all fixed. But you did such a good job. Give me a high five. High five. Thank you. You did such a good job. You were the best patient. You guys, huge thumbs up for an amazing.
All right. Oh, my goodness.
Great young lady. Yes.
That was a lovely place for it to pause. All right. Anyways, so with that one, obviously you didn't hear any noises or anything, but he was really good about how he explained to the girl how he was going to do that, showing her with her good arm before he popped everything back into place. Now, obviously, if you're talking about some of these, there's probably more pain involved, more sound involved. Some of these may require that they be temporarily put to sleep for because it may just be too painful. Now, once the dislocation happens, depending on how much things are stretched, it probably doesn't hurt, which is why she was doing okay just sitting there. Um, but the action of popping it out or putting it back in for that moment is going to hurt. So that's why she was sitting there doing pretty okay before he popped it back into place. All right, so let's talk spinal curvatures. So there are normal curves that are going to exist in the spine, but then anything that is exaggerated past normal is going to be a problem. Okay, so this, you are looking at the spine either straight on or from the back. Okay, so from head down to your bottom, if you are either facing towards me or facing away, your spine should be straight like this. Okay, and then if you're facing towards the side, so this individual would be looking this direction. Okay, so this would be their neck, their upper back, their lower back, and their bottom right here. So you have natural curves to your spine that's supposed to be there. But when they're over exaggerated, then that's going to cause a problem. Okay, so scoliosis is an S curvature. So again, this part of the spine is supposed to be straight. So if we have any curvature of this spine here, then that is going to be scoliosis. Okay, it's fairly common. If you remember possibly going to the nurse's office in sixth grade, I believe, and I think you get another screening in eighth, I think. I think it's like sometime in junior high, sometime in middle school, you'll get screened for scoliosis. It's where you have to like take your shirt off and you have to bend over, like towards the nurse and then like to the side and then to the back and then to the side. And basically they're looking for some curvature to your back. Okay. So scoliosis is where it should be normally straight and we've got a curve to it. Okay. Kyphosis, we are talking about this curve right here. So your thoracic spine. Okay, so this is your upper back. So your neck is here. So this is your upper back here. So exaggerated meaning that it's further out than normal. Okay, so this is also called hunchback. Okay, so a lot more exaggerated curve here in the thoracic area. Lordosis means that down here in the lower part is more exaggerated. So like even further in than this already goes. Okay, so sometimes you'll hear this referred to as swayback. Okay, so scoliosis, kyphosis, and lordosis. So let's look at some pictures. Okay, so this is kyphosis. So this is where we have the exaggerated hump in the thoracic region. This is scoliosis. This is a very severe case, but it is scoliosis. Okay, and then this is lordosis. Okay, so an exaggerated lumbar curve. Okay. And there's a number of different ways that we can fix these problems. So the kyphosis here, scoliosis, and then lordosis. With this one, there's a particular surgery that you can have done, which I have a video for that one that we can watch really fast. But things like this, when we're really curved, you have to remember that your ribs are connected to your spine. So when you start turning your spine in really weird directions like this, you are messing up where the ribs are located. So with a really severe curve like this, you're talking about his hip is way up here now. Well, his rib cage is also right there. So you're talking about things like coming together and like hitting each other, or you're squishing organs or whatever. Like notice his scapula is right here. That's a normal place for it. You can barely even see this one over here because his back is so twisted. So let's watch this video of how they correct for scoliosis. And this is not for everybody. Depending on the curve, most of the time they don't require any major surgery like this. This would only be like in the case of that guy right there. He probably needed surgery. So let's watch this video. I don't know why there's techno music for this. I'm going to turn it down. This is really interesting that they use this small incision in the upper back and one in the lower back, and they can correct the entire spine. Is crazy because before you used to wind up with, after scoliosis surgery, of an entire incision from like your neck all the way down to your bottom. So the fact that they have these two tiny incisions to fix something like this is crazy. So basically, they're going to do this procedure over and over and over again on every single vertebrae of the spine. So I'm going to kind of fast forward past some of this. Okay, so they did it on both sides. So they have the first incision. So now they're about to make the second incision. So they're going to use the tools again to drill into all of the different vertebrae again. Okay, so now that they've gotten all of those on there, now they're going to slip a rod in there to straighten everything out. Oh, sorry, I forgot. Yeah, so depending on how curved the back is, they're going to have to adjust for it. So this, they're going to remove some of the ribs so that they can put it back together to adjust for it. I would assume that this is magnetic, that that's how these work, but then obviously they're going to get screwed on, and those little flap things are going to come down too, I think. And in one simple surgery, you can correct the spine. Oh, now's when they flap little things down. And once you have everything in place, now you can secure it down. So, I mean, you can go in with, before of having like a really bad, so like here, so she had a 55-degree curve in like the thoracic part of her spine for the most part, but her lumbar is also a little off. See these ribs that are coming down right here? And you're talking about you're almost hitting the tops of the hip bones over here where it's not even anywhere close on this side. So because she's been growing at that angle, like things are going to be kind of jacked up. So they do have to correct for that. But you're talking about in one surgery that you can correct it. And she's got these two little scars, and she went from a curve this bad to basically a straight back. So pretty cool what they can do. All right, last little bit. Okay, osteoporosis is the last little thing that we're going to do. So again, we kind of touched on this before when we were first talking about bones. But osteoporosis is a condition where the bones become less and less dense. So remember, we do like spongy bone. It allows our bones to be lighter weight. So we're not just, I mean, you have to imagine like how much you would weigh just because your bones are solid. So they are porous on the inside, but too much makes them brittle and then they'll break. Okay. So usually women and usually those who are older tend to get osteoporosis. Okay, so this is going to put them at risk for fractures, even with a minor fall or something, that they could break something. So that is it. That is it for our skeletal diseases and conditions. If you have any further questions or anything like that, let me know. I'll be back tomorrow, and we'll start talking muscles. All right. See you then.